Closed fractures. So this is a break in the continuity of the bone cortex with associated soft tissue injury, and as opposed to open fractures. The closed fractures do not communicate with the epithelial surface like skin, bowel mucosa, and bladder mucosa. Resuscitation and stabilization of the patient is paramount, and patients should never be sent for imaging unless hemodynamically stable. The causes are road traffic accidents, domestic violence, workplace injuries, pathological fractures, fall from a height, and assaults. The symptoms are pain, swelling, instability, and inability to move the parts. And the signs that are usually elicited are pain, swelling, deformity, inability to move the affected parts, crepitus, shock if there has been significant blood loss, confusion if there is shock or associated head injury. Investigations are hemoglobin, blood flow grouping and cross-matching, x-rays of suspected parts to include joints above and below. So trauma series, x-rays, cervical spine, chest and pelvis if injury is deemed severe or if the patient is confused or unconscious. Also CT scan as for fractures involving the following areas: the head, the spine, pelvis, fractures around joints, and also CT angiograms if significant vascular injury is suspected. MRI to assess spinal cord and soft tissue injuries of the knee. An abdominal ultrasound scan if intra-abdominal injury is suspected. The main treatment objectives are to resuscitate the patient, to save a life first using the ATLS protocol, that's A, B, C, D, to save the affected limb or limbs, to save a limb nest, and also to restore function to the affected limb or limbs. So non-pharmacological treatment, splinting, as POP, back slap, and prefabricated splints, customized splint, and also elevation of limbs as nail pairs until a final decision about surgical or non-surgical management has been made. Manipulation under anesthesia as if possible. Pharmacological treatments for pain relief: you give morphine IV or IM in adults 2 to 5 milligrams 4 hourly as required. In children 50 to 200 micrograms per kilogram 4 hourly as required, or petidine IV or IM in adults 50 to 100 milligrams 4 hourly as required, with a maximum of 400 milligrams per day. In children 0.5 to 2 milligrams per kilogram repeated 4 hourly as required, or paracetamol IV in adults more than 50 kilograms. You give 1 gram 6 hourly as required. Less than 50 kilograms, you give 1 gram 8 hourly as required, with a maximum of 3 grams daily. Children 12 to 18 years with weight more than 50 kilograms, you give 1 gram 8 hourly as required, the maximum of 3 grams daily. And 12 to 18 years with weight less than 50 kilograms, give 15 milligrams per kilogram 8 and 6 hourly as required, with a maximum of 750 milligrams per dose. Also 2 to 12 years with weight less than 50 kilograms, give 15 milligrams per kilogram 6 hourly as required, the maximum of 75 milligrams per kilogram per day. Or diclofenac IM in adults 50 to 75 milligrams 6 to 12 hourly, with a maximum of 150 milligrams daily. In children is recommended. Second line treatment: you give ibuprofen oral in adults 200 to 800 milligrams 6 to 8 hourly as required, with a maximum 2,400 milligrams daily. In children 10 to 15 milligrams per kilogram 6 to 8 hourly as required, the maximum of 40 milligrams per kilogram daily. Or naproxen EC oral in adults 250 to 500 milligrams 12 hourly as required. In children is not indicated. Or cholicoxib oral in adults 400 milligrams start, then 200 milligrams 12 to 24 hourly as required. In children is not indicated. Or you give codeine oral in adults 15 to 60 milligrams 4 to 6 hourly as required. In children is not recommended. The referral criteria: We refer individuals with the following conditions associated with closed fractures to an orthopedic surgeon. Difficult reduction, fractures with intra-articular extension, fractures around growth plates, and when there is neurovascular compromise.